forms of wrist pain is very common in the postpartum stage. We have carpal tunnel syndrome, which is that compression from inflammation in the joints and poor circulation that is very similar to what happens when you're sitting at a computer too long. That can generally present during pregnancy and persist into the postpartum phase. We also have tendinitis in the wrist, which is essentially an overuse injury from carrying either car seats or baby or holding consistently breastfeeding. So what we want to do is talk about the things that we can do to either one, prevent or not aggravate, and hopefully spend some time on the healing phase and get back to a place where you're feeling great and not feeling like it's going to affect your workout. So one of the things that you want to do is rest. And I know that's very difficult when you've got a little one, but you want to try to avoid using that wrist that has a lot of pain in it. Sometimes it's recommended that you get a splint. You can just get an over-the-counter splint, which will remind you to keep your wrist in a neutral position. You can wear it during sleeping, throughout the day. It will also be something you can wear during working out so that it will remind you to keep your wrist in a neutral position. You want to avoid any exercises that are going to aggravate it, so bring you into an impacted joint. So unfortunately, that means things like push-ups or extended plank. And you want to focus on trying to incorporate a bear claw. So you're going to put a bear claw not on the knuckles, but right down into a full fist position. Now, a lot of women really struggle with this because, unfortunately, they do not have any wrist strength. So one of the recommendations that we make to build the wrist strength over time is to just do this not during exercise, but while you're on the floor, at home with baby, crawling around, just starting with gentle, low pressure resistance, and then working up as you can, getting into perhaps a 1, 2, 3 push-ups, whatever you can handle, and building up over time. We also recommend that if you're having a lot of wrist pain, that you do get some healthcare providers to look at it and provide you treatment. Active release therapy is a form of amazing therapy that has helped a lot of women really recover from wrist tendinitis in a fairly rapid period of time.